MPs push forward with plan to fill our NHS with fake doctors. Sorry, physician associates. Are they mad? Fake doctors. What does that mean? Well, in this story that you can see here, this is a consequence of their having these fake doctors. Three fatalities. 30-year-old Emily Chesterton died after suffering pulmonary embolism. A fake doctor said it was anxiety. 25-year-old Ben Peters died from heart hemorrhage. Fake doctor said it was a panic attack. 69-year-old Peter Marshall died of bowel cancer. A fake doctor said it was IBS. So these fake doctors or physician associates have been in existence for a while. And to talk about this, we've got Dr. Bob Gill. How are you doing, Bob?
Hi, Crispin. Very well, thank you.
And also we've got Nicholas Csergo from the Socialist Health Association. How are you doing, Nicholas?
Hi, thanks. Well, love you too.
Now, I didn't know anything about these fake doctors, Bob, but I think you've been sort of warning about this, the whole reforms of the NHS for a while. And these fatalities have been ridiculous stuff there. People not being diagnosed when they go into a GPs or to an accident emergency. Now, can you explain to me? There's another aspect of this that came up, which is there have been 12. This is a tweet from someone called Dr. Dunn. There have been 12 never events linked to PAs, physician associates in Scotland. Scotland has 143 physician associates. If PA/NE ratio was extrapolated to doctors, that would be 31,552 never events. Can you explain what a never event is?
So probably the easiest example to give is if you're going in for surgery, let's say on your knee, the surgeon operates on the wrong leg. That should never happen. It's an obvious error. And in a system which should be focused on safety as a #1 objective, these events shouldn't occur. What the never events and the ratio, the high ratio of never events for these fake doctors or physicians' assistants or associates now, as they've been renamed to confuse people, is they have less experience. You can come out of a science degree, nothing to do with medicine, study medical issues for 2 years, and then be put in the same position as a GP, diagnosing people who present with a whole variety of symptoms. But you have a huge blind spot, and you may be overly confident because when you don't know very much, you realize there's not much to know. It's only the more you study, the more you realize you're only touching the surface. So they don't go through that long training experience, maybe overconfident, big blind spot, and they make deadly calls. This is the problem. And the government are selling this as, oh, they're always going to be supervised. Well, that is another absolute nonsense. And at the same time, these PAs are getting paid more than doctors who've trained longer and passed exams, right? At the same time, we have a junior doctor dispute. And at the same time, the government has created deliberate bottlenecks. So, for example, they're saying, oh, this is a solution to the GP crisis. But for every 3 doctors who've already gone through medical school, done 2 years in foundation training, in hospital, on the job training, for every 3 of those who apply to become a GP, there's only 1 space. So it's not a lack of doctors. It's a lack of training places that the government restricts. And guess what solution they come up with? Employing PAs at more money to start off with, because these plans go over a decade. So they might be being paid very well at the moment, but in 10 years' time, as what happened with GPs actually, they gradually defund it once their mission is accomplished and once the doctors are pushed out of the system.
I mean, this is a job description for PAs. This is from one particular job. But if you see at the bottom, it says, it's got essential experience, desirable experience. It says working in primary care. I mean, that's not even essential. I mean, what does that tell us about the role? I mean, they shouldn't really be doing much at all, should they? If it's just desirable that they've worked in primary care.
Well, it's crazy. So I'm a GP trainer, and I have GPs who are finishing their training come to my surgery for their last year with me, and they're supervised. We do clinics together. They come and run every case past me before they tell the patient how they're going to manage them, and I'm watching them like a hawk. But these PAs will enter into general practice to provide a service. The practice is already very busy. There is no spare capacity to be supervising every decision these people make. And the trainees that I train have had vastly more medical experience. And I supervise them like a hawk to start off with, to find out how competent they are. So they've been on a much longer trajectory. They have a lot wider knowledge, more experience, but their supervision is a lot more regulated and prescribed than we're asking the PAs to do. So there seems to be a parallel universe whereby doctors are held to one level and paid less for it, whereas the PAs can get away with hardly any experience and are paid more. So it's quite perverse what's actually happening at the moment.
Now, the reason why it's in the news, as you saw from the first slide that I shared, it says MPs. I'll just show it again. It says MPs push forward with plan to fill our NHS with fake doctors. Now, the reason for that is in Parliament, in a small room in Parliament, not the main chamber, they had a session there that pushed forward a statutory instrument, which is all very technical for me, which effectively registered physician associates or PAs with the GMC, so that this job group, this job title, these people who've got this position are registered with the GMC. Why is that needed? And also, isn't that a good thing? I mean, if they're registered with the GMC, isn't that what we need?
So on the surface, it might seem like a good idea, but what our politicians who are doing whilst they destroy the NHS, this is not motivated for patient interest. By registering them with the GMC, you further add to the confusion amongst the public. They've deliberately changed the name from assistant to associate. They've got physician in their job title. So this is quite deliberate to confuse the public. And what the public need to understand is they are replacing doctors. You are not seeing a doctor. However, if they say, look, I'm registered with the General Medical Council, they're not medical. They are allied health professionals, and there is a separate regulatory body for those other health professionals, right? The General Medical Council was created 100 odd years ago to make sure there weren't any quacks claiming to be doctors. Now we have a government facilitating this quackery, whereby people sitting there are misunderstood as being medically qualified doctors when they are not.
So the GMC is not actually fulfilling its proper function that it was set out to do, which was to make sure we're safe with people who are medically trained or recognize, knowing who someone is that we can trust.
Absolutely. So the GMC is a regulatory body, and the leadership of that regulatory body are political appointees, right? So the guy who's currently in charge, Charlie Massey, was a civil servant back in 2016 under Jeremy Hunt, who was trying to crush the junior doctors. Now he's a regulator in the GMC. So there's this very cozy revolving door whereby the people occupying these very serious positions are fully aligned with the political agenda. And the political agenda has got absolutely nothing to do with patient safety. It's all about profit generation in due course.
So what about the BMA, the British Medical Association? Here's another body. they must have had something to say about this coming through. So what were they doing to check on this at the start? And I believe that they're now actually saying they're not happy with PAs.
So I've been engaged with what the BMA is up to for over a decade. There seems to be they've refined a performative way of representing doctors. On the one hand, they will make all the right public statements, they will bang the table and claim outrage, but all the way along, they actually end up rubber stamping what the government wanted to do. In 2019, I may have told you this story before, but I went to Belfast to the British Medical Association annual meeting because they were trying to force through this additional role reimbursement scheme for general practice, which meant that you would receive almost fully funded PA posts, right? So what they did was, in the preceding decade, they squeezed GP funding, made GPs desperate for extra finance, and said the only way you're going to get it is if you employ non-doctors. And what did the BMA do in 2019? The General Practitioner Committee said, yes, this is a good idea. They're only here to help. They will never replace us. Well, now time has moved on 4 years down the line, and we're getting news articles about how GPs are now being made redundant, locum GPs can't get work, and we're still aware that there's no settlement of the dispute for the junior doctors in this country. So you can see that financially doctors are getting squeezed and their replacements are getting handsomely rewarded.
And the BMA, what is their position now? I mean, you say before they were quite happy for it to go ahead, but I've seen that they're opposed to this move now.
Their position has changed. Now they're saying, well, we need to halt the recruitment. Doctors shouldn't be signing off prescriptions for these PAs. We shouldn't be supervising them. So the resistance is coming late in the day. Now, is this genuine resistance, or are they just playing to the gallery because there's a growing awareness of this disastrous, catastrophic policy that they endorsed only 4 years ago?
Right, so they kind of don't want to be implicated in it by saying, "Oh, we warned about it. If it all goes wrong," you think that's what's happening in a way?
That is potentially what's happening. And if I go to the most extremely cynical take on this, is to give GPs a false sense of security that the BMA is now going to effectively fight this, so that we don't do anything ourselves. So it stands down the GPs to think, don't worry, the BMA is going to look after our interests. Now, I've been there multiple times in the past, and each time they've sold us out.
Right. So, Nicholas, you've looked at this story, and you seem to think that because it's kind of exploded onto national media, and the idea of fake doctors. I mean, there's stories of people dying from this as well, that it's actually made a big difference to the way people have looked at NHS reforms. But how do you think this is a kind of positive thing then?
Yeah, I mean, I do. I think it's the fact that people are talking about it now, that they're upset about it. That in particular, there are groups of doctors who are increasingly aware of how they've been, what's it called, fooled or lied to by NHS England about this, and other bodies that are supposed to represent, the medical profession and so on. They're quite on social media and Twitter in particular. You can see there's quite a vocal bunch who generally have to be anonymous, not always, and they are seeing right through it, and that they are the ones who managed to get this into the media. This has been a policy at least since the 2014 5-year plan, and you can read it in there, the language in there, and obviously from the start people were told this isn't about replacing doctors, it's about helping and so on. But currently the doctors are noticing that the incentives that are being paid, as Bob hinted on, are not that there is no money to recruit GPs, for example, but there is money to recruit these people as a process of replacement. We're not what NHS England calls transformation of the NHS, which sounds anodyne, which sounds, you can imagine it's a positive thing. It's actually been quite in our face. It's a good thing, but what they're missing generally is the context for this. And that's what's not being talked about enough. And the context includes that, the fact that what is NHS England? NHS England came out from Andrew Lansley's Act, or also McKinsey and Company's Act. They influenced that significantly. Those who were shortlisted to run NHS England included people from the ex-boss of KPMG. Sorry, not a CEO from KPMG, the ex-boss of Kaiser Permanente, and a CEO from United Health. And that gives you a flavor of the direction of policy, right? And it's the United Health guy, the Blair advisor, Simon Stevenson one. And they managed to keep both a low profile at the same of what they're doing intentionally, and you can read about this, to make it sound like they're doing something generally positive, hidden behind the notion of joining up health and social care. Are policies like this based on that US policy principle of rewarding reductions in care? So you're ultimately looking at healthcare on a balance sheet. And if you can spend less, and this is what Operos Health, the company, did when it took over 500,000 GP patients. They've had to leave for their own internal reasons, separate reasons, but they were caught on camera by Panorama hiring physicians associates, and explicitly because they paid half price for them. That was the reason why they did it. And when they did it, they said what they were doing was in line with NHS England's long-term plan. And the BBC didn't expand on this at all, but they were very explicit. What we're doing is in line with government policy, and they were right about that. And the person who had been running this US company in the UK had been a national director at NHS England involved in the so-called new care models. So the context that's missing is that this, yes, so for example, in a WhatsApp group from a lefty health-focused campaigning group I'm in, somebody recently said, so are you saying, what was it? I think I've noted it word for word. Are we now going to be treated by people who aren't qualified doctors to save money? Surely not. And yes, it's not for the government to save money, but yes, this is a deliberate policy destroying the National Health Service. And the context, it's part of a program of policies that are all destroying the health service and that are by and for corporations that are led by, this is the face, if you want to kick out the American health companies from the NHS, this is where you kick them out, policy. They run and implement policy nationally. And you can see that through the Socialist Health Association, I co-wrote a paper called In Place of Profit. And it goes into a bit about the companies that the same people have moved, where they've changed the National Health Service to benefit private companies, and they've gone to private companies and take advantage of those benefits that they created by destroying our services. I'm going to slow down. I won't talk too fast.
Now, can I just come in and ask you about this, because I'm just thinking about people who don't understand this. You mentioned this WhatsApp message that you got. We've been talking about this with Dr. Bob on the show for a while. People still can't believe that anyone would undermine the NHS for profit. There just seems to be this kind of, you're just it's almost like you believe in flat Earth if you suggest that people would have dishonorable intentions who are medically trained or have some kind of association with medicine, that they would want money at the expense of looking after patients, etc., and the patient care. How do you think that can be kind of cracked, that people can actually understand that this is going on? Because you've said you've been saying it for ages. This story has just come out. It's not on the main news on BBC, is it? I mean, you're quite happy that it's on a couple of stories, but
nothing.
What do you think? Do you think really bad stuff has to happen before?
Well, I mean, there's two
Where
things.
do we have to go before people will actually say, God, this has been a disaster, these reforms?
Yeah, I mean, that's the thing. Bad stuff has been happening, but it's been reframed as something else. For example, a few years ago, there was a study that showed half the NHS's beds have been cut. Just imagine that, an orange, like cut in half, you get rid of it, half of it. More recently, Alison Pollock was talking at a talk. She said 3/4 of the beds. I mean, we know it's at least half. I can say that with certainty. And at the same time, we have this narrative which comes through the left as well. It comes out as a neutral narrative. It comes through think tanks that are not the IEA, through the King's Fund, through the Nuffield Trust, that do good research, but are led by people who are, for example, Chris Ham, who ran it for much of the last decade, was the guy who Tony Blair sent to the US to copy the system in Britain, Chris Ham. So he comes onto the news and he's commenting as a sort of neutral representative. He goes and speaks as part of the he had a role within the all-party parliamentary group on health and social care and so on. This is some kind of respectable, independent person. Basically, the bottom of all this that you're asking about is it's politics. You can think now, why would anybody want to destroy? Doesn't everybody want everyone to have access to healthcare? And that's the question. No, 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 no. Private health companies do not want that. They do not want that. It's like in anything else, like the rail privatization. It's like the post office privatization. It's like when you privatize something like that, and they all want to start cutting the things that they're not making money from. The small railway stations that are in far off places where people don't take the train much, the small post offices and so on. And the local GP and the local district general hospital is also for the chop as national policy, written by and for corporations, because there is a political player in this country which is dead set against the NHS. And it's not the Tories. It's not. You can't say it's the Tories, like it's just the Tories. It's private healthcare interests. If you have a whole country where all the needs are met by the state, that was the NHS. That's what it was. The private healthcare companies were complaining for this is a monopoly. Basically, can you do a bit less so we can do a bit more? And how can you take advantage of people? How can you sell your services, for instance, whether it's to the government or to people privately, if the government is already doing it? You can't. You have to destroy what was the National Health Service in order to create space to have it. You have to. And so that is the taboo, the one that you described, the thing that's a conspiracy theory. Oh, there's no evidence. There's loads of evidence. There's so much, I don't swear. Tons of evidence. It's just not used. It's just like blanked constantly. I mean,
so I'll just Bob, you've been sort of saying this stuff for a while as well, but the thing that you've called out is, why don't the unions and those on the left say something? They must know what's happening. You know, how important is it that they actually start doing something about this? I mean, they don't have the interests of private healthcare, do they? They're not sponsored by private healthcare, are they?
Well, if I can return to your media point, you know, by now a lot of people are realizing the media do not hold our politicians to account. They're in bed with the politicians, and as Nico said, the politicians are serving global capital interests. Right? We have Keir Starmer in bed with Larry Fink of BlackRock. So the media persist in painting a charade of democracy whilst our nation's assets are stripped and sold off. That is where we are. The unions, as I've mentioned before, have been co-opted into this project. They've all signed up to something called the Social Partnership Forum. They all rubber stamped the white paper, which led to last year's, 2023's Health and Social Care Bill that went through, which is the culmination of Simon Stevens' privatization plan, the creation of these managed care organizations called integrated care. So the union leaderships and the corporate management of the unions has been co-opted. It's just that the members don't know. a bit like the Labour Party, has been co-opted by the neoliberals, you know, Wes Streeting and Keir Starmer. They haven't got an ounce of Labour in them. They're representing the moneyed interests. And unfortunately, the people who are in leadership positions within the medical and nursing establishment are quite happy to toe the line, enforce ignorance upon their members, and rubber stamp everything that's going through.
Wow. Do you want to say something, Nicholas?
Yeah, I mean, I obviously wonder a lot about the thing you asked, and sometimes you see things that, you know, concretely that say, okay, I see a link between this and that. But there's another issue, is that no one comes in saying, "Oh, we're going to destroy the services and do this." You can read about, you know, for example, Theresa May saying to Simon Stevens, "I want the hospital closures." Hospital closures. I saw that. I happened to see that you were part of the fight for Charing Cross Hospital, right? And that was that's part of a national program of closures and downgrades. It's ongoing at the moment. Jeremy Corbyn fought for the Whittington Hospital in 2000. This is the same trend that was happening under New Labour that began under Thatcher and Major. He fought to defend the Whittington Hospital from being downgraded as part of a national program of closures and downgrades. And at the time, the public was much clearer that this was a national program of closures and downgrades. And I think a lot of lessons have been learned since then. In fact, it's not just that I think. You can read about how Patricia Hewitt was issuing instructions to trusts saying, please don't use the word closures, don't talk about closures, make it about something else. That has become quite sophisticated by now. I mean, you saw Blair talking about changes to A&E, and then suddenly he said cuts at some point, and they laughed at him in Parliament because he was using the wrong word. And then again, this same word was used in the closure of in Hammersmith Hospital. I think there's a clip where there's a councillor who's challenging the fact that they're using changes on the leaflet, which is about the closure of it. So there's a quite a sophisticated narrative has developed, and it is today possible for a trade unionist to say, we're against privatization. We fought the Health and Social Care Act 2012, including I'm quoting word for word a high-ranking health trade unionist, including the dreaded Section 75. Section 75 was removed by Boris Johnson, and it allows crony contracts. Sorry, I don't want to go into a lot of this, but basically there are narratives which you can say, and you can believe them. There are people who believe this, sincerely good politicians who think that the process of installing accountable care organizations, managed care, all these things, which is incentives to cut back services, it's been presented as bringing together health and social care. It took an element because it's several different bodies around a pooled budget, and those bodies cut the services and they get to share some of the money that isn't spent on those as an incentive to cut back the services, which grows private healthcare. If you emphasize the fact that there are several different bodies there, and some of them could be social care, some of them could be health, as joining health and social care, you're lying by omission. A lot of people have gone along with that, have believed that this is what's happening, have even shown glossy examples of how good it is of a service that's a result of this, but not shown the closures that led to that service, or, you know, the new diagnostic centres, which are generally private, because diagnostic centres are a thing that can be run privately, and they're built from the ashes and the rubble of the hospitals that are closing.
Can I just come in? So in a way, that like the hospital closures, or like you said, Charing Cross, they sort of like the threat to your local hospital was not working as a way of cutbacks, because people would call it out. So if you can change the way that whole NHS is managed in a different, you know, and call it streamlining and efficiencies and stuff like that, you can get away with cuts in a way that isn't as materially obvious as closing a hospital or reducing the size of a hospital. Is that kind of their trick, is to not look obviously like they're cutting, but to look like they're changing or they're making it more efficient? I mean, this is the kind of Wes Streeting patter. What's your take on that, Bob? Because they are very clever. I mean, you probably think they're not, but they are, to me, very clever at misleading and hoodwinking people into thinking they're not doing much at all.
Yeah, so, you know, how did Tony Blair, Gordon Brown get away with cutting even more beds than the Tories? Well, they used private finance initiative to saddle hospitals with debt and then say, oh, this hospital's unsustainable. We've got to make some cuts to balance the books. So they go and flog off the hospital down the road, which doesn't have any debt on it. So you end up closing beds. So you have to construct a plausible narrative, be it financial, be it organizational, be it using their favorite chestnut of efficiency, to sell it to the public, because the public are not in a position to realize how sociopathic these policymakers are. Yeah, they're waiting for somebody to come along with horns sticking out of their heads, whereas they'll normally come in a three-piece suit, and they can talk quite posh, and they know the words to use, right? So people are quite deliberately propagandized. They have the snake oil salesman working very hard on them. And then when somebody like me comes and tells them the brutal distilled truth is so far from the mental image that everybody else has constructed for them, particularly the mainstream media.
Yeah. What did you want to say, Nick?
Yeah, narrative. For example, Keir Starmer or Wes Streeting will say, we want to go towards a system that's more about prevention. It's euphemisms. More about prevention actually means less care, less curative care. It's a way of talking about closures. Well, less of an emphasis on A&Es. We're talking about closing A&Es. There's all sorts of language like that, and a lot of it comes straight from the US. It's the same language that Kaiser Permanente CEO uses, and it's just it's selling an empty glass as a glass half full or something like that. You know, so we can go through some of them. There's all the stuff you keep hearing every day. Tell me you haven't heard this. We mentioned there's incentives to bring in alternatives to GPs, but not money for GPs. But the way it's presented is to free up GPs. Why don't you just have GPs instead of having to free up GPs, right? Or talking about all the time bed blockers and freeing up beds constantly. Look for it in the press. Freeing up beds all the time. Why have you cut over half of the beds? Are you going to stop cutting half the beds? You're not. Why are you talking about freeing them up rather than not cutting them anymore? Because the trend is to take care out of hospital, because that's where you can extract just the profitable bits and close the hospitals. So there's a whole language about that. And the right comes across as neutral because they don't come through the IEA on Newsnight. They come through respectable think tanks that provide a lot of useful data, but are also right and led. And that are the ones that inform the narrative that comes in the media and so on. And the left didn't have an alternative one, did not have an alternative narrative about this. And I think the problem was also in Labour, we had the Miliband period in which Andy Burnham, who'd been a health secretary, he shed crocodile tears. He said, I think we let the market go too far. And then he separately tells the Nuffield Trust, well, those of you who heard what I said about the market, no, I don't mean like a monopoly. Of course, the private sector has to be there. And he reframed it. And I think a lot of people who were quite sharp about what both parties were up to, at that point, their attention, it was this narrative, this presentation. When the Lansley Act was coming through and people wanted to fight, and Labour did a big show of opposing it. That this idea that Labour was the Labour of 1948 again, suddenly, despite Blair, that never happened. The only time that could have happened was under Jeremy. And the only time it really happened under Jeremy was when he had a left shadow health secretary. So just reread what Diane Abbott said. Everything she said that was happening then, including the replacement of staff with less skilled staff, as policy is happening still. It's permanent policy. It wasn't just a thing that happened for a bit. It's just stopping talking about it.
So, but to round this off, I mean, just what do you think we can do in election year? I mean, because this is the big year for. I mean, they're both the same, though. The two parties, the main parties, are both saying the same sort of stuff. There's not much difference. There's hardly anything between them. Streeting's not opposed to the reforms that are going ahead, really, at all. What do you think we can do as a strategy to raise awareness for what's happening and to change what's happening?
So we've recently had the exposure of the Post Office Horizon scandal, and Fujitsu and the cover-up within the post office prior to privatization. And that created a political pressure on the government to act, whether it be red or blue government. We need to get to a position whereby, you know, campaigners need to focus on this denial of access to see a doctor, blocking being able to see a GP, this downgrading and cutting access to services has to become the #1 focus, because it's indefensible. You cannot say to the man in the street, see this person who's done medical studies for 2 years because he's just as good as the person who's done 10 years. That will not wash. So it's quite easy to get messaging, very powerful messaging about that. I need access to a doctor to make a diagnosis, right? We need to support the junior doctors in their pay dispute. And, you know, people on the left, Corbyn and others, you know, the Enough's Enough campaign, Peace and Justice, and all these people, if I was them, I'd be saying, how do we stand 50 or so candidates against Labour so we can have a group of independent candidates who might hold the balance of power in a hung parliament? We need to be ambitious, but sitting back and waiting to vote isn't the answer. People need to really wake up that they're actually losing access to seeing a doctor unless they can afford to pay. And, you know, the doctors I'm engaged with, unfortunately, their main reaction now is to run around like headless chickens and look at working in the private sector. This is exactly what the government wanted. You'll only be able to access a doctor, the same as with dentists, if you can pay. And do the public want that? You're already paying once through taxation. Do you want to pay twice? Because that's what we're being asked to do.